People who act out their dreams while sleeping, you could be sleepy too, are more likely to develop a form of dementia, one that's common among the elderly. The findings come from the Mayo Clinic. Dr. James Galvin is a professor of neurology and psychiatry at New York University's Langone Medical Center, and he joins us at the table with some very snazzy socks. But let's talk about you first.
Great.
Because what do you mean exactly by acting out your dreams and the connection between sleep and memory?
Well, generally during sleep, when you dream, REM sleep, only your eyes can move and the rest of your muscles are inactive. Acting out dreams means that people during their dreams will shout, punch, kick, thrash. They're not often aware of it. Often it's the person who's sleeping next to them that becomes aware of it.
It sounds like a nightmare. That doesn't sound like a dream. So what's the connection between sleeping and dementia?
Well, this REM disorder is associated with a dementia called Lewy body dementia. This is the second most common cause of dementia after Alzheimer's disease. Affects about 1.3 million Americans. Sleep is important because during sleep we consolidate our memory, and so it allows us to basically consolidate all the things we've learned the day before and use them going forward. When your sleep is disturbed, memory can be impaired, and this can have a significant impact on people's everyday performance.
Okay, you know every wife right now is like, my husband does that. He kicks and thrashes in the middle of the night. Does that mean he's going to have dementia?
It puts them at a higher risk. It doesn't mean they're going to develop dementia. If this is happening, it would be important to speak with the physician, and they can have a sleep study, which is an overnight study to understand
But is there
this.
anything you can do to stop thrashing and kicking and doing that would prevent dementia?
There are medicines to treat the syndrome of REM disorder. Again, it puts you at a higher risk for developing Lewy body dementia or Parkinson's disease, but it doesn't cause it.
Okay.
It's associated with it.
So what's the value of this study beyond an understanding of the linkage?
The value is two parts. So one, even if you don't develop dementia, having disturbed sleep can have a significant impact on someone's ability to function the next day. Sleep is very important. And if sleep is disturbed, you should talk to your physician about the disturbance in sleep.
Okay, so in order to try to eliminate the disturbance.
Correct.
You know.
And it's more men than women?
It's more common in men than it is in women, and it's more commonly associated with dementia in men who have this disturbance than in women who have the disturbance.
And if you sleep alone, you're just what?
Well, if you sleep
Lonely.
alone, you're lonely. If you sleep
Well, I mean,
alone,
how are you going to know if you have the disease is my
Right.
point.
Well, if you
You
sleep
have to invite somebody in for a test.
A camera will do it too. Just set up a little
Right,
camera in the
let's get
bedroom.
Do you have an answer?
well, first maybe find someone to sleep with, but if not, then if you
She's
find
trying.
it, yeah.
I liked you all before this segment
That's
started.
okay.
Thank you, Dr. James Galvin.